Hi. Welcome to our channel. This question has been on my mind and probably yours as well, especially after getting your latest dental bill. Are sealants worth it for adults? What about for kids? Let's dive into the science together. I'll start this discussion with some good news for those of you looking to protect your teeth long term. Recent studies suggest that dental sealants are highly effective in preventing cavities, even for adults. But is this all there is to the story? Keep watching as we unravel the nuances of sealants, explore their benefits, limitations, and cost-effectiveness for both children and adults. For children, the American Academy of Pediatric Dentistry recommends applying sealants as soon as the permanent molars begin erupting, which typically happens around the ages of 6 and 12. Why these teeth? Because they are the ones that tend to get cavities the most. In fact, studies show that sealants can reduce the risk of cavities in these molars by up to 80% within the first 2 years of application and continue to provide 50% protection for up to 4 years. But how long do these dental sealants last? On average, they can last for about 5 to 10 years. Although this can vary depending on factors such as the child's oral hygiene habits and the quality of the sealant application. During regular checkups, your dentist will monitor the sealants to ensure they remain effective and make any necessary adjustments or replacements. But what about for adults? While sealants are primarily associated with children, they can also benefit adults, particularly those who are at high risk of developing cavities. Who are these folks? Well, adults with deep grooves in their teeth. Those who suffer from dry mouth, perhaps due to certain medications, and individuals with a history of cavities are all good candidates for sealants. For instance, if you have just had orthodontic treatment and your teeth have these deep grooves, sealants could be beneficial. Or if you grind your teeth, causing these deep grooves over time, they could also help. Additionally, if you're undergoing chemotherapy and might develop some of these deep grooves due to the side effects, sealants could be a valuable preventive measure. And don't forget about adults who simply have deep grooves in their teeth. They also stand to benefit from sealants as they may not be able to keep these grooves clean through brushing alone. So, how do sealants benefit adults specifically? Well, for starters, sealants are much cheaper than fillings or crowns. Furthermore, sealants can help avoid complex and potentially costly treatments down the road. By sealing the grooves in your teeth, sealants prevent decay from setting in and causing more extensive damage that would necessitate a more involved and expensive procedure. Instead, with a simple, quick, and inexpensive application, you can significantly reduce your risk of developing cavities. Now, let's address the question, how long do dental sealants last for adults? Similar to children, sealants can typically last 5 to 10 years for adults. However, the longevity of a sealant depends on various factors, including your oral habits, diet, and overall oral maintenance. If you take good care of your teeth and see your dentist regularly, your sealants should provide long-lasting protection against cavities. That being said, it's important to note that sealants have their limitations. They are not suitable for teeth that already have fillings, crowns, or significant decay. In such cases, other restorative procedures may be necessary. Therefore, it's crucial to visit your dentist for a comprehensive evaluation to determine if sealants are a viable option for you. Now that we've discussed the benefits and considerations for both kids and adults, let's tackle some common misconceptions about dental sealants. Some people believe that sealants are only for kids. However, as we've covered, adults can benefit from sealants too, especially those who have risk factors for cavities. So if you're an adult with deep grooves in your teeth or other risk factors, don't hesitate to talk to your dentist about sealants. Another misconception is that sealants are unnecessary if you brush and floss regularly. However, even with excellent oral hygiene practices, sealants can still be beneficial as they provide an additional layer of protection for deep grooves that brushes and floss may not effectively reach. There's also a concern that dental sealants are unsafe or contain harmful ingredients like BPA. However, dental sealants have been proven safe and effective by the FDA. While some sealants do contain BPA, the amount that could potentially leach out is minimal. In fact, studies indicate that salivary exposure to BPA from sealants peaks at 3 hours post-application and returns to baseline within 24 hours. Moreover, if you're concerned about BPA, many dental offices offer BPA-free sealants as an alternative. The process of getting dental sealants is quick, painless, and non-invasive. Your dentist will start by cleaning your teeth thoroughly. Then they will etch the surface of the teeth to prepare it for the sealant. Next, they will apply a resin or glass ionomer-based sealant and cure it using a special light. Overall, the procedure is straightforward and shouldn't cause any discomfort. Despite the evidence supporting their effectiveness and safety, a significant number of children and adults still don't use sealants. This hesitancy might stem from a lack of awareness regarding the benefits of sealants, or perhaps concerns about their safety. However, as we've discussed, sealants are a valuable tool in maintaining good oral health, and they are generally safe when applied by a qualified dentist. It's essential to prioritize preventive measures like sealants to avoid more extensive and costly dental issues down the road. After reviewing all the evidence, the verdict is clear. Dental sealants are definitely worth it for most children and high-risk adults. They offer a low-cost, high-reward solution for preventing cavities and avoiding costly restorative procedures. However, it's important to remember that individual circumstances may vary. Factors such as oral hygiene practices, dietary habits, and the presence of existing restorations can influence the need for sealants. Therefore, consulting with your dentist is crucial to determine the best course of action for your specific situation. As we wrap up this discussion, Remember that prioritizing your oral health is an investment in your overall well-being. Thank you for joining me today. Stay healthy, and I'll see you next time.